Title: Statins and Cognitive Decline in Patients with Alzheimer's and Mixed Dementia, a longitudinal registry-based cohort study. Published in Alzheimer's Research and Therapy, December 2023. Introduction. The brain contains a significant amount of cholesterol, and it plays a crucial role in various processes, such as maintaining cell membrane integrity and supporting communication between nerve cells. Imbalances in brain cholesterol may contribute to Alzheimer's disease through various pathways. Meanwhile, the relationship between high cholesterol in the body and cognition is complex. High cholesterol in midlife has been linked to cognitive decline and Alzheimer's disease in later years through different mechanisms. Genetic factors related to lipid metabolism, like the APOE4 gene, may also influence Alzheimer's risk. Interestingly, high cholesterol in late life is associated with better overall health and cognition. The impact of cholesterol-lowering drugs, specifically statins, on cognition has been extensively studied. Statins can affect cognitive functions in both cholesterol-dependent and independent ways. They may influence processes like the amyloid cascade, tau phosphorylation, vascular factors, neuroinflammation, and oxidative stress. The overall effects of statins on cognition depend on various factors, including patient characteristics, blood-brain barrier integrity, statin characteristics, treatment duration, dosage, and critical time points in dementia development. Despite previous concerns about short-term cognitive side effects, extensive reviews have not consistently confirmed these issues. Some even suggest that statins may reduce Alzheimer's risk. However, clinical trials have generally shown null effects, possibly due to methodological limitations. Our study aims to assess the association between statin use and cognitive decline over time in a large cohort of patients with Alzheimer's or mixed dementia with a focus on statins that cross the blood-brain barrier. Method. We conducted a long-term study using data from the Swedish Registry for Dementia Statins. To understand the connection between statin use and cognitive decline in patients with Alzheimer's disease or mixed dementia. Statins is a nationwide registry collecting information on dementia patients from various healthcare facilities in Sweden. We analyzed data from 15,586 individuals diagnosed with hyperlipidemia or prescribed statins, excluding those with extreme statin usage. We tracked cognitive decline using the mini mental state examination MESI scores over time. Our study aimed to determine if statin use influences cognitive decline in these patients. We considered various factors such as age, sex, residency, comorbidities, comedications, and statin types in our analysis. The results will help us understand the impact of statins on cognitive function in dementia patients and guide future research. Result. Our research involved 15,586 patients diagnosed with Alzheimer's disease or mixed dementia with an average age of 79.5 years at diagnosis. The majority were women, 59.2%, and lived at home. At the beginning of the study, all participants scored an average of 21 points on the mini mental state examination MESI, and 69.7% of them were using statins. Simvastatin was the most commonly prescribed statin, 52.8%, followed by atorvastatin, 14.2%. Common comorbidities included hypertension 40.1%, diabetes 24.4%, and cardiovascular disease 24%. The average follow-up time was 0.86 years, revealing an annual MESI decline of -1.2 points for the entire cohort. Statin users were more likely to be male, younger, and had a better cognitive status at baseline compared to non-users. They also had a higher prevalence of comorbidities and received additional medications. The majority of statin users were incident users, and among them, Simvastatin users exhibited a slower cognitive decline compared to atorvastatin users. Simvastatin users also showed advantages over rosuvastatin users in terms of cognitive decline. There were no significant differences between lipophilic and hydrophilic statin users. But incident lipophilic statin users exhibited a faster decline. Fungal statin users did not significantly differ from synthetic statin users, although younger fungal users showed a slower decline. No significant differences were observed between users of non-statin lipid-lowering medications and statin users. In summary, our study suggests that statin use is associated with a slower cognitive decline over time, with simvastatin showing advantages over atorvastatin and rosuvastatin. Lipophilic, fungal, and non-statin lipid-lowering medications did not exhibit significant differences in terms of cognitive decline. These findings contribute valuable insights into the relationship between statin use and cognitive decline in dementia patients. Discussion. In this study, we looked at the cognitive benefits of using statins over time. In patients with Alzheimer's disease or mixed AD dementia, we found that those who used statins experienced a positive effect on cognition, and this effect increased with the dose of statins. Specifically, patients taking simvastatin showed a slower decline in cognitive function compared to those taking atorvastatin or rosuvastatin. Younger users of simvastatin also had a slower decline in cognitive function than younger users of atorvastatin. When comparing different types of statins, simvastatin was the most commonly used in Sweden during our study. This made it challenging to compare the effects of different statins due to variations in usage patterns. Simvastatin, being a lipophilic statin, has potential neuroprotective properties that may benefit those with high levels of neuroinflammation, a common feature in dementia. Our study is the first of its kind to compare cognitive decline among different statins in patients with established AD and mixed dementia. We carefully adjusted for various factors, including co-medication and cholinesterase inhibitors, to account for their potential effects on cognition. When looking at incident users, those starting statin treatment during the study, we found inconsistent results. This could be due to a time-dependent nonlinear association between statins and cognitive processes or differences in the selection of these users. We also examined the influence of lipophilicity and the type of statin fungal vs. synthetic on cognitive decline. While there were no significant differences between lipophilic and hydrophilic statins, incident users of lipophilic statins showed a faster decline in cognitive function. In summary, our study suggests that statin use is associated with a dose-dependent cognitive benefit in patients with AD or mixed dementia. Simvastatin, in particular, showed advantages over other statins in terms of cognitive decline. However, there are complexities in comparing different statins due to variations in usage patterns and patient characteristics. Further research is needed to confirm these findings and explore the underlying mechanisms. Conclusion: our study on patients with Alzheimer's disease or mixed dementia suggests that using statins may not harm cognition and could even have long-term cognitive benefits for those with indications for lipid-lowering treatment. However, we emphasize the need for a confirming study. These findings encourage clinicians to consider statins for eligible dementia patients to prevent cardiovascular and cerebrovascular diseases. Further research should explore the complexities of dementia's pathogenesis, considering various medications in specific dementia subtypes, and investigating the role of lipid metabolism in Alzheimer's, accounting for genetic factors. Additionally, understanding the inconsistencies in incident statin users requires further investigation, considering the time since prescription. Any research topics you'd like us to cover? Let us know in the comment below. And as always, like and subscribe.